They had a direct line where they could contact a clinician when they were worried about a resident's physical health, having a nurse-to-nurse support because these people were in crisis. They needed peer support as well as us helping look after the residents. We would provide oxygen, we would give antibiotics, end-of-life medicines in a very timely manner if that was required. They help support the residents to a comfortable death if needed. People coming in on weekends and days off to help support the care homes because it was a traumatic time for everybody. And people wanted to do their part and help and support the care homes. One care home said that our team were like their guardian angels, which was really nice. Yeah. Other feedback we've had from GPs as well, because immensely we took over the role that would have been the GPs who couldn't have visited as many different care homes in such a timely manner.
We actually went in and supported the care of the residents when they had depleted staff within the care homes. It has led to real mutual respect within the team, to learn from each other. We've certainly learned loads from our health and social care partnerships. We've learned loads from the care homes themselves. The care home staff, particularly the care homes who don't have registered nurses in them, the work that we've seen and the commitment by these care home staff has been incredible.
Families that have said to us, if it wasn't for you guys, I maybe wouldn't have been able to have those maybe last few weeks with my mother the way that I did, or because that again was maybe us working with the managers, helping them with things like risk assessments. And a manager would tell us, I have a resident here I'm worried about, they're symptomatic, and we literally would just knock the door, tell the clinical chart team there's a care home they're a bit worried, and they would straight away be on the phone to that care home, go out, do an assessment. And that, for the residents, the impact that had, you know, they didn't have to wait for out of hours to get back to them, or GPs who are very busy themselves, you know, they didn't have to wait, they were seen immediately, and that's something as well that never happened before, and it's been, you know, monumental, I think, the change.
It was about supporting the care homes when they were having a lack of staffing. There was a lack of PPE at the start. We had to transport PPE in to support them, making sure infection control was the highest standard. Dealing with the families was quite important because the families felt that they were isolated. We were able to reassure them that the residents were getting taken care of, they were safe.
Hilda was my mother-in-law. We felt it was really important to get her home. The chart team really listened to what we had to say. They're mediating between the families. They managed to set up a risk assessment for us. It made a big difference getting her home. My husband has cancer and he couldn't go up and visit her. If they hadn't stepped in to help us, we wouldn't have seen Hilda again. I can't thank them enough for what they've done for us.
They brought safety, they brought good working practices, they brought PPE, how to wear it, how to dispose of it. The chart team brought that routine back into care homes at a time of real chaos in all our lives. They also brought that care to families, because families were excluded from our care homes. But the teams contacted the families and said, they're fine, their well-being's good. They also, I think, brought hope. The teams touched so many lives with what they were doing and how they cared for these people. And they've done a remarkable job. The work they've done is just beyond comprehension. We have comfort in knowing that all our care people are looked after.
They supported the staff, they supported me, and I wouldn't be here had it not been for them. I wish they'd been here 10 years ago.
The care homes had to write a risk assessment to allow visitors into the care homes, and public health were really struggling for capacity to assess these. On a weekend, both Saturday and Sunday, many members of the chart team came to the department and helped us process through all of these. And that was simply, demonstrating excellent teamwork, but also the level of care that they really wanted visitors back into the care homes as quickly as possible. And what the chart team have done is develop a very robust process for both assessing and supporting homes in this. And that's allowed public health to be confident that there are excellent processes taking place. And there is evidence around this in the fact that despite exceptionally high COVID outbreak rates in the communities, actually relatively the care homes have been pretty stable. And that exemplifies just what effect their excellent practice is having.
Just feeling embraced, do you know what I mean, and taken under a wing. So we're now not just HC1, we're HC1 plus a larger family. The difference that it made just to know that somebody was out there, that they were here to help us, made a big, huge difference to everybody's lives, including the relatives, the residents. They were there for us. To be perfectly honest, I don't think we could do without them. Fingers crossed to get this award because they so deserve it.